Welcome, nursing students. Today, we are diving into one of the most incredible and vital roles you'll ever have, caring for a brand new human being. We're going to walk through the essentials to give you the confidence and the evidence-based knowledge you need to support newborns and their families, right from the very first moments of life. Okay, let's jump right into the deep end. Picture this. You're in the delivery room. A baby has just been born. They're 1 minute old. The clock is officially ticking. What do? This one question really frames everything we're about to talk about, those immediate, life-sustaining actions that are the heart of newborn nursing. So that first hour, it's absolutely critical. Your number one job is to support this little one's incredible transition from the warmth and safety of the uterus to the outside world. I mean, think about it. It's a massive physiological shift, and you are their primary guide and protector through it all. Now, what's really important to understand here is that these 4 steps, they're not a neat one after the other list. They're all happening at once in a kind of controlled chaos. You're quickly assigning those APGAR scores to see how they're doing. At the very same time, you're getting them warm and dry to stop any heat loss. You're starting the clock on monitoring their vital signs. And right in the middle of all this crucial medical stuff, you're also helping facilitate that beautiful first moment of skin-to-skin bonding. It's a true masterclass in multitasking. Okay. Every single newborn gets a few routine medications, and your role here is really twofold. You're the one giving the meds, but you're also the educator. You're the one who calmly explains to nervous parents that the vitamin K shot is essential to prevent a serious bleeding disorder. You'll be the one applying the erythromycin eye ointment to prevent an infection that could literally cause blindness. And for babies who need it, you'll give the hepatitis B vaccine and HBIG, that's hepatitis B immune globulin, for immediate protection. The key takeaway? Knowing why you're doing something makes you so much better at explaining it to new parents. All right, so the baby's stable. We're out of that intense first hour. Now your role starts to shift a little bit, moving towards vigilant, ongoing assessment. We're going to focus on the 3 big priorities you'll be watching like a hawk over the next few days. First step, and this is a big one, breathing. A newborn's number one job after birth is to clear all that fluid out of their lungs and start breathing effectively and regularly. Your job is to make sure that transition happens safely and to be able to spot any signs of trouble right away. You need to burn these signs into your brain. These are the red flags of respiratory distress. Little nostrils flaring out, an audible grunting sound with every breath, that classic seesaw breathing where the chest falls and the belly rises. These are all signs that the baby is working way too hard to breathe. Catching these early is a truly life-saving nursing skill. Here is a pro tip that has a huge impact on patient safety. Just think about it for a second. If you stick a suction in the baby's nose first, their natural reflex is to gasp. And if their mouth is full of fluid, they could breathe it right into their lungs. So the rule is always, always, always mouth first, then nose. M comes before N in the alphabet, M comes before N in suctioning. It's a simple trick that makes a huge difference. Let's move on to our second priority, blood sugar. Newborns just don't have a lot of energy stores, and many of them are at risk for low blood sugar or hypoglycemia. Now, the tricky part is that they often don't show any obvious signs, which is why your proactive screening is so important. So what do you do if you get a low reading? It's simple. Feed the baby. That's the first and best thing to do. And take a close look at step 3. We avoid glucose water. You know, it might seem like a quick fix, but what it can do is cause a big insulin surge, which then leads to a rebound crash in blood sugar. So the bottom line is feed first. And our third big priority is bilirubin. Jaundice is incredibly common in newborns, almost expected, but it's your job to figure out when that normal, slight yellowing of the skin could become harmful. Early recognition and getting it managed is absolutely key. This is a non-negotiable, golden rule in newborn nursing. The human eye is just not a reliable tool for judging how severe jaundice is. You might look at a baby and think, yeah, they look a little yellow, but you must confirm it with an objective measurement. That means using either a transcutaneous bilirubin, that's TCB, or a total serum bilirubin test from a blood draw. This is what we mean by evidence-based practice. Don't guess, test. All right, let's talk about things like bathing and taking care of the umbilical cord. It's easy to just think of these as tasks on a checklist, but in reality, every single one of these routine things is actually an expert nursing intervention that's evolved over time, all based on solid scientific evidence. Just take the first bath, for example. We used to whisk babies away and clean them up right away.
But look at this. The research has shown us that delaying the bath has some amazing benefits. It reduces stress on the baby, it helps them stay warm, it helps them keep their blood sugar stable, and it even improves breastfeeding outcomes. This is a perfect example of how our nursing practice changes based on what the evidence tells us is best for our patients.
And it's the exact same story for cord care. The old way was to routinely use alcohol swabs or dyes on the umbilical cord stump. But now we know the best way is actually much simpler and more effective. Just keep it clean and dry. Fold the diaper down and away from it, let the air get to it, and only clean it with a little water if it actually gets dirty. In this case, less is definitely more. So let's pull all these ideas together under one really powerful theme. As a newborn nurse, you are the ultimate safeguard. You are the primary protector for this completely vulnerable, tiny new patient. And that means security is everything. You are the gatekeeper. You will check those ID bands every single time an infant is brought to a parent, no exceptions. You will teach parents to be just as vigilant. Your constant awareness is what protects your patients from something unthinkable happening. Now let's break down one of your most important teaching roles, safe sleep. The message has to be simple, clear, and consistent. It's all about the do's and the don'ts. Do put the baby on their back. Do use a firm, flat surface. Don't let them sleep on their stomach or side. Don't use soft bedding or bumpers. Your ability to communicate these rules clearly can absolutely save a life. Okay, finally, let's talk about sending them home. Your job isn't done until you've empowered this new family with the confidence and the skills they need to have a safe transition. You are literally their bridge from the safety of the hospital to the rest of their lives. Before any baby goes home, you are the final checkpoint. This checklist is your safety net. Are their vitals stable? Check. Are they eating, peeing, and pooping? Check. Have all the screenings been done? Check. And this is a big one. Can the parents actually show you they know the basics? This is not just paperwork. It is your final act of protection. And let's just zero in on one last critical point. You, the nurse, must personally watch and document a successful feeding. Why is this so important? Because feeding problems are one of the top reasons that brand new babies get readmitted to the hospital. By making sure they're off to a good start, you are directly preventing complications and another hospital stay down the road. So as we wrap this up, I want to leave you with this question to really think about. Beyond all the clinical tasks and the checklists, your role is deeply, profoundly human. It's about teaching, it's about reassuring, and it's about empowering people. So how will you use your knowledge not just to care for a tiny infant, but to build up a confident new family ready to start their journey home?